With just under 2 months until the North Carolina legislative session reconvenes, lawmakers are told they should not expect Medicaid to save as much money as projected. Health and Human Services leaders say expected savings will fall 1/3 short, or about $40 million. Republican leaders say they aren't happy.
You know, this is the fifth year in a row we've had overruns in Medicaid, and they total about $2 billion of state dollars that, frankly, has really made our budgeting process very, very difficult and has caused the rest of our state government to really suffer through this process.
DHHS and state legislative analysts have been studying the implementation of changes to Medicaid authorized by the 2013 state budget law. Democratic Senator Floyd McKissick wants to know how projections are so off the mark with multiple experts reviewing the same Medicaid program.
I think it's also important to have the appropriate information flow, but also enhance communication to the maximum extent feasible between the physical staff, between the state budget office, and with the people in HHS, so that when these forecasts are done and it looks like we're not going to be able to realize savings to this magnitude of 1/3, that we get to know that information sooner rather than later.
We are adding staff, we are adding resources, high-level, high-powered, high-talented resources. We are very confident of our ability to perform financial analysis and to do forecasting.
DHHS Secretary Dr. Aldana Vash says her team is understaffed and lacking talent as a result. Affordable Care Act provisions, 2 brand new DHHS computer system rollouts, and the fact that it's county workers handling much of Medicaid has placed financial forecasting in the background.
That complexity with a decreasing workforce that we have right now, an enormous challenge to find people to apply for jobs with the skill sets. Where are those world-class actuaries? Where are the world-class project IT managers? Where are the world-class analysts that can help us discover this? Please, I beg everyone, step up to public service and apply for these jobs. Otherwise, we're going to the outside consultants, and you're aware of the finances behind that.
But Senate Republicans like Mecklenburg County's Bob Rucho believes budget writers could have known and maybe should have known about the lack of Medicaid savings months ago.
What our frustration is when we're trying to do our budget is getting numbers. And I asked Mr. Brennan, who is not new to the system, Mr. Brennan, how many times have you had an opportunity to work with our staff, our fiscal staff, who have been doing this for many, many years, and all of a sudden I hear you later say, or just recently say, you know, we'll get back with you to look at that analysis. That should have been done 3 or 4 or 5 months ago, not now. Okay, and if you all don't communicate with our staff, we've got a lot of talented people there. Not all, Madam Secretary, with all due respect, is sitting in DHHS with all the smarts in the world. Apparently there's some problems there.
We wish that we would be able to get it perfect between all 3 of us, because 3 different parts of government, because we have a mutual goal. This is where we are working towards with our partners. We wish it was quicker. Unfortunately, the timing where we are and where everything unfolded with the IT systems and the Affordable Care Act did happen in 2013. That was not in anyone's control, sir.
Other legislators are focusing on $365 million in pending Medicaid claims. That's money owed to doctors for seeing Medicaid patients. House Minority Leader Representative Larry Hall worries doctors may eventually refuse Medicaid-backed customers.
What happens to the providers who aren't getting those claims resolved, who are now not providing services to our citizens, who then have more expensive treatment?
Every single thing we do, we try to ensure that there is no denial of service. So to be very clear on that, and we have many abilities and opportunities, whether you call them workarounds or other process, where we ensure that there is not a denial of a person getting medical care.
Legislators on this general government committee are giving state health and human services officials credit for fast one-on-one service for doctors who aren't getting paid quickly, and they also acknowledge those new computer systems have been tough to debug. But they want more communication and more firm data on Medicaid expenses, which they say is eating cash that is set aside for other North Carolina priorities, like pay raises. Kelly McCullen reporting for North Carolina Now.